Good morning. It's Dr. Scott, Chiropractic Associates in Long Grove, Illinois. Recently, we were talking about scoliosis. I saw an interesting study on adolescent idiopathic scoliosis that I thought you might find informative. Maybe you have scoliosis, or maybe you're concerned about transferring scoliosis down to your children. There seems to be a genetic component. Scoliosis tends to run in families, maybe a little more prevalent in females than males, although when we say that, we end up missing some of the scoliosis diagnosis in males. So scoliosis is an abnormal curvature of the spine. We've got some normal curvatures in the spine. Scoliosis is an abnormal curvature of the spine. Seems to be related maybe to trauma. Maybe you have a slip or fall. Who doesn't have a slip or fall when we're growing up as a child? Learning to walk, for instance. And it can cause some disruption in how the muscles act and react. Sometimes there can be some alignment issues, and this can then escalate at times to create inflammation and pain, although not always. So some interesting takeaways from this study. 4 large studies, hundreds of scoliosis patients on adolescent idiopathic scoliosis, abbreviated AIS. They found that spinal manipulation plus exercise offered the best outcomes for these kids with scoliosis. And the wonderful thing about chiropractic care, spinal manipulation, exercise, there are no side effects. You might have a little bit of discomfort, but that seems to be the worst side effect that seems to happen with chiropractic care and exercise treatment. And they found that the curvature, what's called the Cobb angle, actually improved with chiropractic care and exercise. And as I mentioned, really provided the best outcomes. This is important because if scoliosis progresses, if it gets worse, we worry about it compromising cardiovascular function, cardiopulmonary function. We worry about gastrointestinal issues. Obviously, general functionality, how well your back and your spine is able to move so that you can participate in day out life. And then pain can be present, although interestingly enough, oftentimes it's not present. And then aesthetics, it looks bad. Your posture isn't good, and you might have a hump or a bump in your back, and so aesthetically, it's not very nice to look at. So chiropractic care plus exercise seems to be effective. Now, the thoughts on chiropractic care and exercise were positive, however, not large enough and not significant enough to recommend it fully. But when you contrast that to bracing, when you contrast that to other more invasive, let's say surgery, I think most of us look at it and say, hey, it's worth a try. It doesn't have to be completely proven because of its safety and because of its low side effects to try chiropractic care and exercise. So when is the time to try chiropractic care? When is the time to look for scoliosis? It seems to begin in adolescence. So, 8, 9, 10, 12 years of age, and it tends to slow about 16. So in our children, we want to start examining for scoliosis. We want to start working with scoliosis, 9, 10, 11, 12 years of age. That's the time to identify it and slow the progress and kind of turn things around, if you will. So if you were a friend, family member, has scoliosis, you're concerned about scoliosis with your children, get them checked up. Get them checked up at the chiropractic office. It seems to offer a perfect solution, a perfect alternative, a perfect early prevention for the identification and prevention and treatment of scoliosis. So my name is Dr. Scott, Chiropractic Associates, and it'd be our pleasure to work with you on scoliosis.